and gentlemen. We will start the program shortly. But first, let me remind you of the house rules for today's webinar. So when you enter in the webinar for the first time, type hi and where you're from in the chat box. So for example, hi from Rizal, Philippines, and you could also greet your fellow nurses that's in here in the chat box. And of course, to listen, you'll need a good quality headset. And please type the following code. So type Y to show you can hear us. Type N means you cannot hear us. Type YN means our sound is breaking up. And type question mark means you don't understand anything. And during the webinar, participants other than the moderator and the speaker will be muted. So please maintain proper etiquette in the chat box. And please save your questions at the end because we will try to answer your questions one at a time. So you can type your questions in the Q&A box. And of course, stay seated and be present. All right, so again, good afternoon, everyone. Thank you for joining us in today's webinar called Mind Over Matter, a guide to mental health awareness at the time of the pandemic. I am John Paul Bringas, and I will be your moderator for today. And before I introduce you to our speaker, I would like to call on our dear President, Ma'am Connie de la Cruz, for her opening remarks.
Thank you, Paul. Good afternoon, everyone, and welcome to Health Carousel Philippines webinar. We're glad you joined us. The topic of the webinar for today is a sound mind at the time of pandemic. This topic is very timely in many different levels. Over the past 2 months, our lives have changed drastically. Our lives turned upside down due to the pandemic. This is most especially for you, our healthcare professionals and our frontliners, who are faced daily with enormous challenges like increased workload, long work shifts, fears of contaminating yourself and your family, working with new, frequently changing protocols, among others. And these challenges can result to mental fatigue, stress, and higher level of anxiety. This webinar will give you information that will guide you on how to keep a sound mind and maintain your mental well-being at this time of health crisis. As your partner, giving this webinar is our way of showing our appreciation for what you do and for the sacrifices you make every day. All of us in Health Carousel Philippines are deeply grateful for your dedication, commitment, and courage to save lives. You are truly our heroes. I would like to thank our resource speaker, Dr. Queen Angeli Berris, for customizing this webinar for healthcare professionals. We will continue to work with you in coming up with webinars in promoting mental health and wellness for our candidates and for our internal employees. So again, thank you for joining us this afternoon. Stay safe and healthy, everyone, and happy learning.
All right, thank you for that beautiful message, Ms. Connie. And now, let me introduce you to our speaker for this afternoon. And yes, it is with special excitement that I am pleased to welcome Dr. Queen Angeli Onrubia Berris to our webinar for today. So let me give you a background of Dr. Berris. So Dr. Queen is a graduate of BS Biology in the University of the Philippines, Manila, and took her Doctor of Medicine in the University of Santo Tomas. She also went to University of Technology in Mara, Malaysia, to take human genomics. Also, Dr. Berris is the President CEO of ExactMed Incorporated, of Gene Sequencing Analysis Center and Medical Clinics. She had years of medical experience in different hospitals and corporations around the Philippines. Over the years, she is conducting various seminars, workshops, and even retreats. She's also a medical lecturer and speaker for Pfizer, Medicus, and Telecare, and Asian Life. And today, Dr. Berris is here with us to share how to sustain a sound mind in the midst of the pandemic. So everyone, please welcome, fellow nurses, please welcome a sound mind at the time of pandemic to be led by Dr. Queen Onrubia Berris. Good afternoon, Doc.
Good afternoon, Sir Paul. Good afternoon, everyone. Sa lahat ng ating mga kababayan who's in the Philippines and outside the Philippines, magandang hapon po sa inyong lahat. I feel so blessed and happy that we are given this chance to talk about something that is so relevant at this time of at this current situation that we have this pandemic. I entitled our webinar this afternoon as Mind Over Matter, a sound mind at the time of pandemic. This is not just any ordinary mental health awareness webinar. This is specifically designed for our modern day heroes, no? Yung ating mga medical frontliners. I hope at the end of the webinar, we would be able to at least help our heroes to alleviate their anxieties, to actually take care of themselves at this time. Okay, before I start, let me share my slides first. Okay. Working within high-stress environment is actually familiar for healthcare workers. We are actually trained to work with focus and composure as we perform our duties, even in a very intense situation. But yet, the COVID-19 pandemic introduces a new challenge for us. There's a chronic stress and pervasive uncertainty that threatens both the physical and mental health of frontline workers. But in spite of this, our modern day heroes every day decide to remain in the battlefield with courage, with motivation and inspiration. So in tribute to our modern day heroes, this webinar is designed to actually help them fight this uncertain fight, and hopefully at the end of it, we win over the COVID-19. Just to give everybody an overview, flash in your screen is actually the statistics on mental health status, on mental illnesses before the pandemic. In the Philippines alone, we have about 3.3 million Filipinos suffering from depression, with suicide rates in about 3 to 6 males and 2 females per 100,000. That is according to the Department of Health. Globally speaking, we have close to 9 million prevalent cases of mental, neurological, and substance use disorders, 3.3 million of which are anxiety, 2.6 are depression. But what is very striking is the statistics of the WHO, or the World Health Organization, which states that one person dies every 40 seconds because of suicide. So imagine from the time that I started talking here, ilan na po ang namatay dahil sa suicide. And this is before the pandemic. And this is a general statistics for the general public. So what more to our medical frontliners na talagang nakaharap, lumalaban, no? Imagine the stress, the fear, the anxieties, the worries that they are facing every day, no? Every time they go to work. Just to give you an idea of our current statistics, during the first SARS, a few years ago, there was a research that states 68% of frontline healthcare workers experience high levels of stress. But currently, just in China alone, we have Jian Bolai from the Department of Psychiatry at Zhejiang University School of Medicine in Hangzhou, China, and his colleagues conducted a study specifically for healthcare workers, about 1,257 of them in 34 hospitals in China at the peak of the COVID-19 pandemic. And the result there was half of the participants had symptoms of depression, while 44.6% had anxiety symptoms, 34% had symptoms of insomnia, and 71.5% showed signs of distress. So if we notice yung numbers on statistics sa impact, sa psychological impact of our current situation is really, really very significant, no? Especially to our healthcare workers. In some other studies, they stated that the psychological impact of a prolonged quarantine and a prolonged pandemic usually emerges at about 6 months from the time it started. So we are just on the 5th month. Pa-enter pa lang tayo ng 6th month. So imagine, these numbers was done in January to February. So imagine how the numbers went up at this moment. So by this, we would know the significance na kailangan talaga ng psychological support of our healthcare workers. So I have been mentioning the term mental health since I started speaking. So I think it is but important for us to understand ano ba yung mental health. There are various definitions of what mental health is, but I want to focus on the definition of the World Health Organization. Because in their definition, it shows there the 4 properties of a good mental health. Okay? So according to WHO, 4 yung properties ng good mental health. One is, an individual is supposed to realize, know, and believe his or her own potentials. Dapat alam mo kung saan ka magaling, alam mo kung saan ka maganda, alam mo kung ano yung kaya mong gawin, at naniniwala ka doon. Because that would initially give you the push to actually function what you are expected to do. The next property then is you're supposed to know how to cope with the normal stresses of life. Nakalagay dyan normal stresses of life. No? So having a good mental health doesn't mean having no stress at all. If your objective is to actually eradicate stress, I am 101% sure you will fail. Because we cannot eradicate stress. Araw-araw talaga may stress yan. In all your actions, in all your endeavors, stress is actually present. Paggising mo pa lang, no, pagmulat pa lang ng mata mo, that is already biological stress. Okay? So kailangan you are capable of coming up with a system on how you could cope with the normal stresses of your life. But what is special at this time, no, the stress that is brought about by COVID-19 is not actually normal. No? Sabi nga natin, we are now entering into a new normal. The normalcy that we are not used to. But then we have to adapt to. Okay? And the third property is you're supposed to work productively and fruitfully. It is not enough that you just exist, that you just survive. Kailangan may bunga yung ginagawa mo. May substance, may significance yung ginagawa mo. Which is connected to the 4th property, which is you're supposed to be able to make a contribution to your community. You must be aware that you are actually part of a community, of a society, of a group, na ang your actions, your functions could actually impact the community. I gave stress to this 4th property because this is very, very much relevant to the work of our medical frontliners. The jobs that we are doing today is actually having the biggest impact to our community, no? Not only within the country, but globally, so to speak. Okay? So, kailangan ma-appreciate natin yon, ma-identify natin yon, ma-recognize natin yon, and appreciate the fact that every detail that you do in your jobs kahit saan man kayo sulok ng mundo, no, has this big impact. That's how important what you're doing right now. Now, with the 4 properties that I have presented, dapat present yung 4 na yon. Pag present yung 4 na yon, then you can say that you are in a good mental state. So mental illnesses are health conditions, on the other hand, involving changes in thinking, emotion, or behavior. That is according to the American Psychiatric Society. Generally speaking, it is characterized by some combination of abnormal thoughts, emotions, behavior, and relationships with others. So let me stress here, no, yung word na changes and abnormal. Pag sinabi natin changes, so if you are used to behave, to think, and to feel a certain set of thoughts, feelings, and behaviors, and then you have a sudden change or a radical change on that, and you go beyond reason, those are hints that you could be undergoing or experiencing some sort of mental disturbance or mental disorder. Okay, but I want to emphasize to everyone, having a mental disorder doesn't mean you are crazy. It just means that you need to be processed, you need to be helped. Most probably, you would need professional help so that you could actually go back to your usual function. No, kaya ko sinasabi dito para medyo mabawasan yung ating stigma na pag ikaw ay dineclare na may mental illness or even if you just sought professional help, you are already crazy or baliw or buang. No, you're not. Okay? And you could actually function, go back to your normal function once you are processed properly. So, as I have said, we designed this webinar specifically to our medical frontliners. Ano ba yung mga nakaka-stress or what are the stressors among our medical frontliners? Okay? So, nandyan yung pressure of caring for patients. Of course, the mere fact that you're caring for somebody living, that you're handling life itself, is actually a stress. No? Then it is amplified by the setting of a virus with the human-to-human transmission and no specific life-saving treatment. No? So bukod dun sa stress na nag-aalaga ka ng pasyente mo, that you have to take care of somebody who has a family, somebody who is significant, whose existence is significant. Madadagdag pa doon that you are taking care of a patient probably against a virus, no, na pwede kang mahawa, na hindi natin alam anong gamot. Okay? There is also the stressor of handling life and death situations while simultaneously putting one's own life at risk. So every time you go to your work, no, nandun yung risk mo na pwede kang mahawa, pwede kang mamatay, pwede kang magkasakit, pwedeng magkaroon ng negative impact yon sa iyo. Okay? The stress of extended shifts with increased volume and severity of patients. I'm sure you have been aware of the number of cases of COVID cases all over the world. No? There are some countries na hindi na nga sufficient ang facilities nila to accommodate them. Okay? So basically, the manpower also becomes insufficient. So nandiyan na yung nag-extend tayo ng shifts, no? Instead of going on an 8-hour, 16-hour duty, it can go beyond kasi kulang na sa tao, sa dami ng pasyente, sa laki ng volume. Okay, so there goes exhaustion, physical, emotional, and mental exhaustion. Nandiyan din yung triaging patients while knowing that there is a limited number of supplies, equipments, and facilities, which is a very, very common problem among all medical facilities all over the world. Kulang ng PPE, kulang ng facility, kulang ng ventilator, no, kulang na ng kwarto, kulang na ng kama, and the rest. Okay? We also have making critical decisions for their patients in the absence of familial bedside input. I remember if you're in the hospital every decision that has to be made for the patient, every procedure, every decision that we have to input in the condition of the patient, we always ask the consent either of the patient or the family. If the patient is not capable of deciding, then we ask the next of kin. But at this time, at our situation right now, wherein most of the hospitals and facilities does not allow relatives to actually stay in the hospital, sometimes medical frontliners are the one who decide for the patient if the patient is not capable, or if there is quite a little possibility of contacting the relatives behind, or if the decision is needed immediately. Okay. There is also the stress of witnessing high volumes of death, including infection and deterioration of co-workers. Kahit na sanay naman tayo na every now and then we see death in our workplace, pero yung volume of death ngayon compared to the usual normal that we encounter, plus seeing colleagues contracting the infection, deteriorating, and even dying as well, no, is also a big stressor. There is the stress of facing the guilt of potentially infecting a family member since you are exposed, no, yung pag-uwi mo, na baka mahawa mo yung pamilya mo, baka madala mo yung virus pag-uwi mo. The stress of being away from home, especially for our heroes who are not in the Philippines right now, that there is a pandemic, you are far away, you cannot be physically supporting your family. And of course, there is the daily decision of choosing between going to work or thinking about your life. If you go to work, you'll have the risk. If you don't go to work, kamusta naman ang magiging buhay mo? Okay, so these are just samples of the common stressors that medical frontliners encounter every day. So all these feelings, the exhaustion, the fears, the worries, if you are under quarantine, the feeling of lack of freedom, if this becomes prolonged, it is possible to develop a particular mental disorder. No? So hopefully at the end of this, we could help our frontliners to at least prevent, no, and know a little something on what to do para hindi mag-develop. With the number of mental disorders that we have, which I won't be explaining all of them, I just listed here the most common ones that are seen to be developing among health workers at the time of pandemic. So nandyan yung depression. Depression means it is a disorder characterized and among other symptoms by prolonged depressed or low mood and loss of interest in activities. No, so ito yung laging low ang mood mo. Wala kang ganang kumilos, wala ka ng motivation. Some of people with depression already experience the lack of purpose, the lack of significance. No, those who are having suicidal ideations and even suicidal attempts could even think na the world is better off without them. No, and this becomes persistent. Etong feeling na to. So yun yung characteristic ng mga depressed. One of the most common symptoms of depression actually is excessive sleeping, no, tulog ng tulog. Although in the general public, this is very common in the ages 15 to 25 years old, but this is also very, very common now, as I have projected the numbers with you earlier, among healthcare workers. Pag sinabi naman nating anxiety, no, the anxiety disorder share in common intense worry and fear that affect thoughts, feelings, and behaviors, and even physiology. Let me differentiate yung pag-worry lang sa pagiging anxious na, yung talagang meron ng anxiety disorder. Katulad nga ng sinabi ko kanina, there are two things that we think are hints no? Para malaman natin kung ako ba ay pumapasok na sa pagkakaroon ng disorder or normal pa to. One is if it disrupts your function. At pangalawa, if it goes beyond reason. So let me give you one example. For example, you are a parent. At this time of pandemic, you worry about your family. Na baka magkasakit sila, baka mahawahan mo sila, or if you are far away from your family, paano sila kaya? Nandito ako, wala akong magagawa, hindi ako makakatakbo, malayo ako sa kanila. No? If you worry about those things, that's actually normal. No? But if you begin to, for example, develop insomnia, hindi ka na nakakatulog, hindi ka na nakakakain, your immune system starts to go down. No, you cannot work properly anymore. You cannot think properly anymore. That becomes a disorder. No? Pag hindi ka na nakaka-cope up with your anxiety, that becomes a disorder. Next, we have what we call the post-traumatic stress disorder, which are usually seen in healthcare workers at this time of pandemic. It is a mental health condition that's triggered by a terrifying event, either experiencing it or witnessing it. No? So, ngayong panahon na to na meron tayong pandemya, we both experience and witness the pandemic. Most of us are in quarantine. Most of us are seeing the numbers of cases, new cases. The graphs are going up. The death toll are rising. The economy is going down. So nakikita natin yon. We are witnessing it. And we are actually experiencing the difficulty of adapting to the new normal that we are entering right now. Especially the treatment against this COVID-19 are still uncertain and unclear. Okay? So the symptoms are generally grouped into 4 types. There is what we call the intrusive memories, avoidance, negative changes in thinking and mood, and changes in physical and emotional reactions. No? So ito na yung nananaginip ka ng bad dreams, nandyan yung in the middle of your work, mariremind ka na we are in the middle of a pandemic, no? How dangerous it is, that the virus is basically everywhere, hindi mo alam saan mo makukuha. Nandyan yun, you don't want to talk about it. You don't want to face that reality that the problem of the COVID-19 is there. Okay? The negative changes in you, nandyan yung nagiging irritable ka na, nandyan yung you are keep on thinking negative thoughts, you are projecting negative thoughts and negative emotions. Okay? And then other physical disturbances. No? Pwede kang magkaroon na ng hives, there's changes in your skin, your immune system is going down, you cannot sleep, you cannot eat. Basically, you cannot function properly. So these 3 disorders are the most common and rampant at the time of pandemic, specifically to our healthcare workers. In this slide, let me show you on a little tool on how to help us identify the state of mental health. Okay, so makikita natin we have actually 4 columns, the green, the yellow, the orange, and the red columns. Listed here are just samples of the things that manifest, depende kung nasaan ang mental health state mo. Okay? So, assuming that everything is normal, wala tayo masyadong problema, we are not in the COVID-19 era pa. Okay? So, magsa-start ko with the healthy mental state. At this state, you are usually calm and steady, nakakakain ka, nakakatulog ka, you have the motivation to stay fit and be healthy. Okay? Though your moods are fluctuating, but the fluctuations are still reasonable and you still could function well. Okay? You are in control of your physique, your mind, and your emotions. You are productive. You are still aware and you uphold ethics and morality. Your sense of humor is still intact. Pwede kang mag-joke. Nakaka-appreciate ka ng joke. Okay? You can engage in recreational activities. You still know how to make yourself happy. Okay. You're active socially and confident. No, so usually ganyan ang picture of a healthy state of mind. Now, once a tragic or negative event happens, we usually react. No, so we go to this next column, the reacting column. Okay, this is still normal. You're actually expected to react. Kung halimbawa wala kang reaction, there is really no difference when there was no pandemic and now there is a pandemic at hindi ka naapektuhan at all, then that is actually questionable because we are expected to react after a tragic or a negative event. So during this reaction, no, nagkakaroon tayo ng changes in the behaviors, in our emotions, and in our thoughts. Okay? Nandyan yung we are easily agitated or angered, na-frustrate tayo, nalulungkot tayo. Sometimes we have difficulty of focusing or yung sinasabi natin na lutang, no? Or absent-minded. Okay? We have little motivations to do things. Ayaw natin makipag-usap. Yung iba ayaw lumabas, yung iba ayaw maligo, no? Yung mga ganyan, laging nervyoso, impatient, yan. So nagkakaroon ng negative reactions, which is still normal. Ngayon, paano natin malalaman kung hindi na to normal? Okay? There is actually a timeline for us to allow ourselves to feel and do these reactions. No? So pag tinanong nyo ako, Doktora, gaano katagal bago mag-move on? Okay? Bago tayo, kumbaga, bumalik or at least start to move on. No? We don't expect move on agad, but at least start to move on. So medically speaking, you have 2 months. No? 2 buwan. So for that 2 months, you can have the reactions, the negative reactions. You can allow yourself to bring out those reactions. Actually, kailangan nyo yun. Kailangan yung ilabas nyo. Pwede kayong umiyak, pwede kayong magalit, pwede kayong magmukmok, no? But after 2 months, you're supposed to start at least doing the first step of moving on. Hindi expected na on the 2nd month, move on na. No? If you can do that, why not? Better. Pero at least, after the 2 months, you start having changes of moving on. Kung yung 2 buwan hindi ka naliligo, at least man lang, after the 2nd month, kahit magwisik-wisik ka man lang, maghilamos ka man lang. Or if ayaw mong makipag-usap sa kahit kay Nino for 2 months, after the 2nd month, you start talking to at least one person or kahit hi, hello man lang. No? So nag-uumpisa na. Huwag niyong masyadong aalagaan beyond the 2 months, the negative feelings, reactions, and behaviors that you have. Remember, the control is with you. Kaya niyo yung kontrolin. No? So give only yourself 2 months. After 2 months, start ka na. No? Pick up yourself. Okay? Because if you don't do that, you go to the 3rd column, the orange column, which is the endured column. Yung sa orange column, no? Ito yung nagiging persistent na yung mga negative reactions, negative behaviors, negative thoughts and feelings mo. Okay? Nagiging persistent. Tuloy-tuloy na, lagi ka na talagang galit, lagi ka nang malungkot, na lang iyak, lagi ka na lang lutang. No, so nagiging persistent yan. And if you go about this beyond 6 months, it starts to put permanent damages on your mental state until you become mentally ill or have the disorder. So very critical yung ating yellow at orange na column. Kailangan hindi ka aabot dun sa orange. You have to do something about it. No? On the reaction stage pa lang, you have to do something about it. You have to intervene yourself. No? If hindi mo kayang gawin mag-isa, pwede kang mag-call a friend or better yet, you call a professional para hindi tutuloy sa injury and eventually a mental disorder. Sabi nga natin, mental health is more than just the absence of mental illness. It includes how you feel about yourself and how you adjust to life events. positive quality of the individual's daily living. So dapat may positive quality daw ang ating pang-araw-araw na buhay kahit na nasa gitna tayo ng pandemya. So the next critical question is, Doc, ano yung pwede nating magawa? Okay? Of course, iba-iba tayong tao, iba-iba tayo ng pag-iisip, iba-iba tayo ng paniniwala, but there are things that we can actually try to do and try to develop para mabigyan tayo ng sapat na lakas, no? The mental strength to actually face the challenges that we have right now in the middle of the pandemic. No? So one is develop that ability to enjoy life. In any crisis that you're into, develop that ability na pasayahin ang sarili mo. No? Kahit gaano kapangit o kahit gaano kagulo yung sitwasyon na meron ka, hanapan mo, no, ng paraan na mapapasaya mo pa rin yung sarili mo in the middle of that crisis. And one of the most powerful tool to do that is basically the power of positivity. And the power of positivity, it means na naniniwala ka na lahat ng sitwasyon merong positive at merong negative side of it. The question is always, saan ka titingin? Saan ka maniniwala? Ano doon ang isa sa buhay mo? Okay? Just for example, you are working, no? And then you got promoted. So kung titignan natin at first glance, it's a good event. You were promoted, maybe you have a better pay, more privileges, more prestige, okay, more staff. Okay, that's the good side of it. Pwede mo rin tingnan yung kabilang side, the bad side. Higher expectations, more responsibilities, no more overtime, no? More reasons to be envied. So ang tanong uli, ibabalik ko sa inyo, saan kayo titingin? Would you look at the positive or the negative side? No? Kaya ko sinasabi sa inyo yon, it's because I want to stress that you do have the control to choose where to look at, the negative or the positive side. Kung baliktad, halimbawa somebody in your family had COVID and died. No? Pag tinignan mo, it's a tragic event. I lost a loved one. I lost somebody na sanay akong parte ng buhay ko. No? Iiiyak mo yan. You will mourn for it. No? Pag tinignan mo lang yung bad side of you lost somebody. Pero pwede mo rin tingnan yung good side of it. Maybe at least that person will no longer experience the hardship of facing this pandemic. Or maybe at the time that that person was already sick, hirap na siyang huminga, no? Or makina na lang ang nagpapatakbo sa buhay niya. So better yet, magpapahinga na lang. No? That believe that that person most probably is in a better place. So again, we go back to the question, saan ka titingin? Yung pagkawala ng tao na yon, or yung benefit niya that he or she is already at peace at wala na siyang problema. Okay? So, ganun yung ating power of positivity. And again, let me remind everyone, you have the choice. You have that power. So, I suggest you use that power. Next is we have what we call resilience. Ito yung bouncing back, the ability to bounce back. No, pag nadapa ka, the ability for you to get up again. Hindi tayo mga perfectang tao. Definitely, every now and then, madadapa tayo, mamumroblema tayo, will feel down. But how strong is your resilience to actually get up, go back to normal, or even be better than what you used to be? No, so that's resilience. Iba yung discussion ko ng resilience with the general public, but I want to discuss resilience specifically for our medical frontliners because you need this very much in your work, no? Para ma-overcome nyo tong challenge of the pandemic. No? You need the resilience. So in psychiatry, there is what they call the CBT tool, no, or the cognitive behavioral therapy that they use to actually build the resilience. Sa mga studies na basa ko, very effective itong tool na to to build the resilience of medical frontliners. Basically, the principle of this is you're able to identify, no, na yung thoughts mo affects your behaviors affects your emotions affects your thoughts, at paikot-ikot yan. So in the middle of a panic, in the middle of a highly intense, stressful situation, no, it is very effective for you to actually slow down, stop, identify these three things that you feel, that you do, that you think, no? I-identify mo yon at paano ka naaapektuhan nun, no? So, a part of this CBT or the cognitive behavioral therapy is basically slowing down. Having that time para pag-isipan yung mga nasa isip mo na, nako, etong sakit na to, itong COVID-19, this is very infectious, this is very dangerous, this is quite hard to manage kasi hindi pa natin alam ang gamot. Okay? Ano yung nararamdaman ko dun sa thought na yon? Natatakot ako eh. Okay, natatakot ako na baka tamaan ako nitong sakit na to or tamaan isa sa mga pamilya ko or baka ako pa yung maging sanhi, baka kaya sila mahawa. No? So ano ba yung naging behavior ko sa takot na yon? No? Nagtago ba ako? Hindi na ba ako nagtrabaho? Nawala na ba ako ng gana sa pagtatrabaho ko? Did I lose that motivation to actually work? No? Or am I more challenged na hindi, kaya ko to? I think I'm better than what I am thinking I am. I have better capabilities than what I believe I have. No? So ganon, being able to slow down, stop, and identify, again, your thoughts, your behaviors, and emotions. Because one affects the other two. No? Kaya nga, titignan natin sa illustration na to, paikot-ikot siya. No? Because it is interlocking. It affects each factors, your emotions, thoughts, and behaviors. Okay, this therapy is commonly used by professionals, no, by our psychiatrists, our psychologists in managing healthcare workers nowadays, no, especially our medical frontliners. Pero pwede nating umpisahan. Of course, I cannot teach you how to do the whole therapy, but at least we can start on our own in the middle of our work, in the middle of our panic, in the middle of this pandemic, to start identifying your thoughts, behaviors, and emotions and how it impacts you. Ngayon, kung negative ang impact sa inyo, it is about time to check ano yung pwede mong magawa, ano yung kailangan mong baguhin dun sa thoughts mo, dun sa feelings mo, dun sa behaviors mo, para mabawi mo yung negative impact, no? So that the negative becomes positive impact for you. Na imbis na dahil sa takot mo, nawalan ka na ng motivation, yung takot na to, pwede mo siyang gawing challenge. O ano, kaya mo ba to? Diba? Kaya ko to. Alam ko, kaya ko to. I am a strong person. So, you become more motivated, you do your job better, you become more careful in protecting yourself, no? So, dapat na ano mo yung sistema yon sa sarili mo. Paano mo na shift from a negative impact of your thoughts, emotions, and behavior to a positive impact. Next is aligning proper mindset. Okay? Sa ating mga modern day heroes, no, our medical frontliners, okay, changing mindsets is aligning proper mindset is very important for you at this time. Dahil dito, isa to sa magiging tool nyo para maging positive ang impact nung sa CBT na minention ko earlier. Okay? So, flash on screen on the left side are the things that you can do and you might not do, no? The do's and don'ts regarding how you face your stress. Okay? So, sinasabi dito dun sa blue column, ano yung dapat mong gawin in the face of stress para kung ano yung mindset mo. At yun nandun sa kaliwa, yung sa red na column, makikita nyo ano yung mga dapat nyong hindi iniisip with regards to your perception of this particular stress. No? Like halimbawa nga sabi ko kanina, nakakatakot ang COVID-19. No? So wag mong isipin tong stress na to as a threat. Anyway, kung titignan natin, lahat naman tayo will come to a point that will go. Hindi lang natin alam kung kailan. Sabi ko nga, everybody may tanning. Okay? It's just that a matter of when. Okay? So, it's not basically a threat na talaga. Hindi siya threat. Kasi every day, with or without the pandemic, we have a threat. So, instead of thinking of it as a threat, why not think of it as a challenge? Yun yung sample of aligning proper mindset. Okay? On the right side of your screen, you would see the 3 different mindsets, the fixed, the growth, and the benefit mindset. At this time of pandemic, at the nature of your work, it is very important to understand the last column, which is the benefit mindset. Kanina nga, sabi ko dun sa properties, the 4 properties of a good mental health, nandiyan yung contribution to the community. That's the 4th property. Kung titignan mo, dun sa benefit mindset, basically, you focus purposefully on why you do what you do. This is very common sa ating mga healthcare workers, na isipin, kailangan ko ba talagang ituloy itong trabahong to? Bakit ko ba pinapahirapan yung sarili ko? Why do I need to go through this danger? Endangering myself every day I go to work. Or kung ikaw ay pasok pa lang sa trabaho mo, if you're just about to start your job, nandyan yung, itutuloy ko ba to o hindi? Okay? Dito sa benefit mindset, iaano mo na, bakit nga ba itutuloy ko to? Bakit ko nga ba gagawin to? Now, what is basically the purpose why I will do this particular job? Is it only because of the money? Is it because of my family? Is it because I want to feel fulfilled? Is it because I want to make a difference? So, titignan mo yung impact nitong gagawin mong trabahong to o itong ginagawa mo tong trabahong to. Anong impact nito? Anong benefit nito? At sinong nagbe-benefit? At para sa'yo, sino ang mga importanteng maka-benefit sa gagawin mo? Yesterday I was browsing dun sa FB page ng Health Carousel Philippines, and I was looking at the different stories of our medical frontliners. Nakakatuwa kasi I've seen a lot of stories telling us na nare-realize nila kung gaano ka-significant ang trabaho nyo ngayon. Sabi ko nga, it might be scary, it might be dangerous, but this is the perfect time for you to actually have that Miss Universe answer to make a difference in the world. This is the perfect time for you. So if you have that benefit mindset, ganun ang maiisip mo. Na ang gagawin ko, hindi lang ako basta kikita kasi may trabaho ako. Hindi lang basta mapagdugtong-dugtong ko yung gastos o makapagpadala ko sa pamilya ko. Hindi lang natatapos doon. There are more benefits now. So if we see it at that point of view, na, oh my God, diba? See how this impacts not only me, not only my family, but basically all over the world. Na sa bawat isang pasyente na aalagaan ko, there is one person that has a chance to recover from this virus, and that one person might make a difference, in winning against this pandemic. So I think that that is one good thing to think about whenever you're at work, whenever you're scared, whenever you question yourself the purpose why you are there. Why are you in the hospital? Why are you in the clinics? Why are you seeing patients? Diba? So this I believe would help our medical frontliners a lot. Yan. No? So pinalaki ko lang yung ating benefit mindset para at least to remind again na it would be beneficial for everybody, especially in your industry, to have this kind of mindset right now. Definitely, it would alleviate the stress, depression, the anxiety that you have and you are experiencing right now. Next is having proper focus. Okay? Kanina, mindset, benefit mindset. Ano yung purpose, ano yung kagandahan ng ginagawa mo, bakit ka nagtatrabaho ng ganyan, etc., etc. This time, when we see proper focus, saan ka nakatingin na mag-iimpluwensya sa iyong reaksyon, sa iyong nararamdaman, sa iyong iniisip, no? Sa iyong behavior. Okay? So basically, pag ganitong uncertain, no, sabi ko nga kanina, one of the stressors we have are the fears na nai-experience natin, no? Usually, the fears that we have are rooted on the unknown and uncertainties. Na yan ang isa sa kinatatakutan natin sa COVID-19. The uncertainties of it. Makakahanap ba ng gamot? Ito nga ba talagang simptomas? Kasi pwede palang walang simptomas, pwede palang meron. Lahat ba mamamatay pag nagkaroon nito? Lahat ba mahihirapan huminga o pwedeng hindi? Yung mga ganyan, di ba? Everything is uncertain. Magkaka-vaccine ba? Ito bang gamot na to? Effective ba talaga? Okay? Pag sinuot ko ba itong lahat ng PPE na to, am I really protected? Yung mga, yan yung mga uncertainties natin. No? Naku, ang dami nang namamatay. Ang dami ng new cases. Yan. So it's important for you to actually set and separate the things that you can do something about and the things that you need to let go na wala sa inyong control. Okay? For the things that you can do something about, do your best at it. So at this time of the pandemic, ano ba yung pwede nating magawa? For us to be protected, for us to at least feel safe, no? So nandyan yung palakasin natin yung katawan natin by having the right diet, enough sleep, having your exercises, your hygiene, your physical distancing, okay? At work, wearing your proper PPEs, knowing how to dispose them, no? So yan yung mga bagay na may magagawa ka. You focus on that, okay? Versus focusing on the disease that is uncertain at this time. Pag yun at yun ang laging iniisip mo, every day you will be in panic. Every day you will be under stress. But then you cannot do something about that. The coronavirus is there. COVID-19 does exist. Yung mga namatay, talagang namatay na sila. Wala kang magagawa doon. No? So the person that you can control is yourself. So focus on the things that you can do to yourself. So that eventually you will feel that sense of safety, that sense of security. Kasi alam mo may magagawa ka. Okay? So yung fears natin would actually minimize. Next is you gather facts to minimize your fears. No? Alamin mo yung mga facts that you think are useful for you to improve yourself in facing this pandemic. But I have to warn everybody, please don't collect facts kung saan-saan lang. Not just on your social media or anywhere else. Kailangan yung mga facts na ginagather nyo, una, useful sa inyo. Hindi yung ikakatakot nyo lang. Pangalawa, make sure na reputable yung pinagkukuhanan nyo ng facts na yan. For example, the World Health Organization, which is the governing body all over the world now, no, who is in the forefront of battling against this COVID-19, then maybe you can just check their website kung ano yung mga magandang gawin, ano yung status. Isang fact, wag kung saan-saan. Okay? Next is establish your supports. No? Get facts from the different supports. Identify ano yung mga supportang nasa paligid mo that you can actually access. so that you will feel safer, you will feel more secured. Kung saan man ang area mo, i-check mo. Halimbawa, you are already experiencing some distress, you are experiencing some post-traumatic stress disorder already, nade-depress ka na, you are having anxiety attacks, check mo, alin ba dito ang pwede kong itap to help me, no? Meron bang, for example, an institution that offers virtual help on psychiatric conditions, no? Or maybe check mo yung makontak yung mga tao na sa tingin mo makakapagpakalma sa iyo. Check their numbers, how to contact them. If you are not in the Philippines, if you are far away from your family, check the quickest way, the easiest way to actually connect with your family, no? How to contact the embassy, how i-establish mo na yung mga facts na yan. Kasi pag meron kanyang mga yan, no? Kung sino yung tatawagin mo in case of emergency, yan. Pag meron kanyang mga ganyan, it will add to your feeling of the sense of safety and security. Next is flexibility. So makikita po natin sa ating screen, no? We have a group of words in different colors. Okay? Pag pinabasa ko po sa inyo yan by the letter, it would be quite easy. Kung basahin nyo ng mabilis, no? For example, purple, yellow, red, black, red, green, red, yellow. You can actually read it fast, nang walang pause, nang walang stop, na hindi ka nagsaslow down. Pero pag pinabasa ko sa inyo yan ng mabilis, by the color, you will notice na medyo may konting delay. No? Like red, blue, green, yellow, green, black. No? Mas may difficulty na pabilisin. Kahit na alam mo naman yung colors. Okay? So this is just a demonstration on how difficult it is to shift paradigms. Pag sinabi po nating paradigm, this is a deeply rooted belief. When we were growing up, we were taught to read by the letter. No? So pinakabisado sa atin yung alphabet, tinuruan tayo magbasa using the letters. We were never taught to read by the color. That's why ngayong malaki na tayo, pag nagbabasa tayo, sanay tayo na by the letter. So it's easy for us. But when I ask you to read it by the color, medyo nahihirapan kayo. No? Because you have that paradigm of reading by the letter. But sometimes in life, no, kailangan natin to develop the flexibility to be able to cope up with that particular crisis, with that particular stress. No? Most often than not, meron tayong mga problema or mga bagay na pinoproblema natin because we believe it's a problem. But maybe, no, if we look at it at different directions, okay, at different angles, posible nating makita na ay hindi pala problema. If we know how to shift once in a while our paradigms, yun yung ability to be flexible or yung flexibility. No? So sometimes we need that. Katulad ngayon, in the time of pandemic, we are entering to what's so-called the new normal. Okay, kung dati, pag nagkikita kayo ng mga friends nyo, beso-beso, you go out and eat out together, no, wala masyadong physical distance, yung mga ganyan-ganyan, everything is very convenient, no? Ngayon, everybody's adjusting kasi maraming restrictions, maraming hindi pwede, maraming danger, ganyan. So, kung i-insist mo sa sarili mo na problema to, masistress ka. Pero if you would be flexible and look at different angles, you might discover that some new facets of this new normal might be applicable or fitted for you. So hanapin mo yon and you focus on those things. Okay? This ability is like this. No? If you see the picture on the right, some of you might see an old woman with a large nose, a long chin, okay, na may curly na bangs. Okay? Some of you might see a young lady with a very defined jawline and a necklace and a fur coat. The ability to be flexible is being able to see both women in the same picture. In life's application, being flexible is being able to see the different angles in a single situation. And from looking at those different angles, different perspectives, coming up with a sound decision on how to approach that situation. Next is learn to calm yourself. Okay? Kahit na sinasabing, okay, the pandemic, the COVID-19 is very scary, it's very alarming, okay? Pero up to this point, we could still say there is still no room for panic. Pag nagpanic ka, lalo kang madedelikado. Pag nagpanic ka, you would have a higher risk of deciding a wrong decision or doing a wrong move. No? So kailangan meron kang system on how to calm yourself. There are various relaxation techniques that you can do. So mamili kayo ano yung pinaka fitted for you na nakaka-relax sa inyo. Maybe listening to a relaxing music, having meditations, having your breathing exercise. Yung iba, nakikita ko in the social media, they're connecting with nature. No? So nag-planting sila. Some of them are putting plants inside the house. Okay? Yung iba nag-grow ng mga vegetables, ng mga succulents, yung mga ganyan. So find your way of relaxing. Different people have different ways of relaxing themselves, of calming themselves. Hanapin nyo. Kung hindi nyo pa alam at this point, hanapin nyo yon. Because you need that. Okay? Again, let me stress to you, there is always no room for panic. So learn to calm yourself. Next is socialize. Since the start of this pandemic, no, lalo na nung nag-quarantine na yung mga bansa, yung mga different areas in and out of the Philippines, okay, we have been hearing the word social distancing a lot. No, it's becoming a colloquial term na yung social distancing. But for me personally, gusto kong i-correct yon. No, there's a difference between social distancing and physical distancing. As of this time, as of this situation that we have, what we need is physical distancing. Yan yung kailangan 2 meters apart tayo, naka-cover tayo, naka-mask, naka-face shield, naka-goggles, yung iba naka-respirator pa, naka-PPE suits, no? Bawal ang beso-beso, shake hands, hug, kiss, no? That's physical distancing. And we need that. We need that to control the virus, no? But don't stop socializing. We are actually blessed that we live now in a world of high technology, that socializing, communicating is quite easy now than before, no? Dati, magastos pa kung maglo-long distance ka or mag-overseas call ka. Ngayon, we have a lot of platforms to do that, to be able to talk and see the people that we want to socialize with. Gawin niyo yun. Kung halimbawa kayo ng barkada nyo, once a month, lumalabas para magkita-kita, magkape, magparty, pwede nyo gawin yun na once a month, you can have a conference call, no? A video call, magkita-kita kayo, tell jokes, ganun pa rin. No? Don't stop socializing because humans are naturally social beings. You will really feel distressed pag hindi ka nakapag-socialize. No? You will feel overwhelmed if you face this problem alone. So kailangan maramdaman mo na hindi lang ikaw ang dumadaan dito sa pandemyang to. Hindi lang ikaw ang may pinagdadaanan in the middle of this pandemic. You are not the only medical health worker that are having those fears. It is actually relieving to share with someone na natatakot ako. To share with someone na ano kayang pwede nating gawin? To brainstorm, no? Or to at least hear the voice of that person comes down. Very important po yun. So please don't forget to socialize. Okay? That would benefit you very, very much. And one way, if I may suggest, of socializing is actually helping people. No? Kung halimbawa, feeling mo in distress ka na and all, you are already questioning your capability, try to help somebody. That would bring back your sense of purpose. That would bring back your sense of fulfillment. You can use your jobs to do that, or you can do simple things like tawagan mo yung isang kaibigan mo, tanungin mo, okay ka lang? Do you need somebody to talk to? No? Try helping. That's a very good way of socializing. Hindi kailangan physical ang help, hindi mo kailangan lumabas, hindi mo kailangan mag-fundraising, magpa-charity event. Not those things. Simple things that you can do to help. No? If you are in a home quarantine right now, try helping the household chores. No? Try doing something na productive sa bahay, tulungan mo yung kasama mo, gawin yung gripo nyo, yung doorknob nyo. No? So try helping. It gives you a sense of purpose. It gives you a sense of significance. That would also be helpful para hindi nyo ma-feel yung depression. And finally, keep the faith. And I'm talking about two kinds of faith here. One is keeping the faith to yourself. Yung faith mo sa sarili mo na may kaya akong gawin eh. Even though na natataranta na ako sa dami ng pasyente, takot na ako kasi baka magkasakit ako, mahawa ako, takot na akong makahawa ko ng iba, init na ako dito sa PPE ko. No? Believe that you can actually do it, that you can pass through this. How, di ba sabi ko nga kanina dun sa 4 properties of good mental health, you're supposed to know your capabilities. Alam mo dapat kung anong kaya mong gawin, kung saan ka magaling. Gamitin mo yun. At maniwala ka dun. No? If you are a medical health worker, believe that you can actually help your patients. Believe that you can actually protect yourself. No? So have faith in yourself. Otherwise, mapanghihinaan kayo ng loob, especially for those who are far from their families. No? Do not expect other people to validate your capabilities. Ikaw dapat ang unang-unang taong magva-validate niyan sa sarili mo, na kaya ko to. So you keep the faith sa sarili mo. And of course, keep your faith. Might it be kung anong religion you belong to, kung anumang name na tinatawag mo to our God, no? Keep that faith. I saw this meme in the internet that says the giant in front of you is never bigger than the God inside of you. Okay. This is very timely sa atin, no? Parang sinasabi sa atin to ngayon. Though ang kalaban natin hindi natin nakikita, it's a microbe, it's a virus, but the impact of this COVID-19 is like a giant. Para tayong sinampal ng higante at patuloy na sinasampal. But if we believe that the God that we have is bigger than this, why fear? Why worry? Kaya. Because the God inside us is bigger than this giant in front of us. Remind yourself that every day, every single day, until the time na manalo tayo against this pandemic. And I am very positive, no? Mananalo tayo. Kaya natin. We just need to find the way to win over this. There is definitely a way. Hinahanap pa lang natin. So don't stop finding it. No? Don't give up. Kung nandun kayo sa trabaho ngayon, you are continually battling against this pandemic, tuloy nyo lang. Strengthen yourself and believe na we can do this. Hindi ka nag-iisa. The whole world is actually fighting against this. And again, a reminder, yung trabaho nyo ngayon, you are modern day heroes. You are medical frontliners. Has one of the greatest impact in this fight. Isa sa inyong mag-give up, may impact yon. So again, question yourself, why give up? And of course, isipin natin, hindi lang tayong may pinagdadaanan, Etong nasa gitna tayo ng pandemya, so we need to stop once in a while, look around, listen to what people tells us, what they say in between the lines, no? So that we would live. And I mean, really live. Remember, mental health is just as important as physical health. So kung lagi tayong nagpapa-check up noon, we have programs in the company that takes care of our physical health, I think it is the best time now to think of how we keep our mental health intact, which is one of our best weapon in fighting this pandemic. So again, to all our medical frontliners, a big round of applause for you. Thank you so much, our heroes. I salute you. I am now ready to answer the questions that you have.
All right, so we're back now. Thank you so much for that mind-opening discussion, Doc. And before I actually entertain or ask questions, Doc, I'd like to, acknowledge our nurses who's with us right now. So we have nurses from Dubai, from Singapore, from Saudi Arabia, and what I found out here, we have nurses from the Visayas region. So maayong hapon sa inyong tanan. So I tried to speak in Visaya, but just to greet you guys, and of course to all the nurses here in Metro Manila, near provinces in Metro Manila. I see we have nurses from Quezon, we have nurses from La Union. So yeah, good afternoon to you guys. All right. So we're now here in our question and answer portion, and again, you can type your question in the question box on the Zoom meeting. And if you're watching us on Facebook, you can also type your questions on our Facebook live comment box. All right. So, Doc, let's start with the first question. Okay. So, the first question here, Doc, from an anonymous attendee. So, his question says, "Hi, I'm a nurse in the Middle East in the COVID-19 ward. My experience was losing my Filipino COVID positive patient by suicide inside the hospital bathroom. He hanged himself using a mobile charger, and I believe I was mentally not okay for some time. The effect of this was feeling guilty or feeling responsible about it since he doesn't have a guardian. And nowadays, paranoia from both the virus and suicide is part of my work. I know the risk, but because of my experience, I tend to go bedside a lot and exposing myself unnecessarily because I want to check on my patients. Am I still coping properly?"
Okay. Basing on what you have told me, no, the incident that happened to you wherein you witnessed as a patient that committed suicide is getting into you. You are feeling quite guilty, sabi mo nga, you are feeling quite responsible for that. But remember, the only person you can control is yourself. So even though you extended all the help, all the support, you took the best of care of that patient, it was the patient's decision to take away his life, not yours. You are not the reason why the patient was pushed to commit suicide. It was that patient's decision. So you have to convince yourself that every now and then you have to take time and talk to yourself. Not allowed, baka mapagkamalan ka, no, pag malakas. But basically, reassess yourself and convince yourself, it wasn't my fault. Hindi naman ikaw ang pumatay. Hindi naman ikaw ang nagdesisyon para magpakamatay siya. As long as you did your best, as long as you did what is expected from you, or even if you did more than what is expected from you, you have to be at peace with that and convince yourself that.
All right, so I hope Doc was able to answer your question. So, Doc, I have here another question. So it says here, "Hi, Doc, good afternoon. So I had an episode of depression a while back, and looking back, I think I'm relapsing again. So does this have to do with me not continuing my meds? I have tried suicide before, to luck that never prevailed. I was confronted before by my physician about this, but contemplating now,
I knew I lied. And recurrent thoughts of me dying never left. Should I take my meds again?
Yes, you have to reassess yourself, the difference when you were taking your meds and not. But before you take your meds, you need to consult a professional first, a psychiatrist first, for you to be able to take the appropriate meds and dosing for you. Okay, even the appropriate combination of medicine if you need more than one medication. But yes, you have to consider taking the meds again. It's good that you have identified it now that you need the help. Okay, definitely negative events like this pandemic would trigger recurrence, no, of episodes of depression. So mas maganda kung sino yung available dyan, whoever is accessible na professional dyan sa place mo, you tap that person, maybe virtually, no, kung pwede, and then have the consultation for that, so you would really know if you need to take the meds again now. Yeah.
All right. So, Doc, another question here. What do you do when loved one has passed in the midst of pandemic?
Okay. So, primarily, you have to let yourself mourn. Huwag niyong pigilan, no? Kung nasasaktan ka, mamimiss mo, gusto mo umiyak, do it. Allow yourself, you owe that to yourself. But after which, you have to start teaching yourself to accept yung loss na yon, no? Sabi ko nga kanina, tignan mo dun sa focus mo. Huwag lagi na namatay siya, nawala siya sa akin. So tignan mo lahat ng anggulo, no? That would best fit for you to accept the fact that the loved one is gone. No? Kasi death is inevitable with or without the pandemic. No? Patay man dahil sa pandemic or hindi dahil sa pandemic, there would come a time that you will actually lose a loved one. So, ngayon pa lang na hindi pa, no? Try to start learning how to accept things like that. Pero yun nga, it is very critical to allow yourself to mourn. Sabi ko nga, after 2 months, you start moving on.
Okay. Next question here, Doc. Hi, Doc. How do we, the question is pertaining to health workers. So how do we health workers handle discriminations from others? Because they have the fear of getting infected because you're exposed to different patients.
Okay. That is a very common occurrence right now, no? Kahit na digitally speaking, we are being applauded and nagbibigay ng maraming tribute, but in reality, a lot of discrimination are occurring. Okay? So una, think of your safety first. If you think merong danger to your safety, no? So you have to be very careful. Hanggat kayang wag lumabas, hanggat kayang wag i-expose yung sarili mo sa iba, better. That's physically speaking. Now, mentally and emotionally speaking, the discrimination should not get into you. Remember, yung validation na kailangan mo dapat nanggagaling sa sarili mo, hindi sa ibang tao. So, i-discriminate ka man or i-appreciate man ang ginagawa mo, doesn't matter that much. What matters is what you believe yung impact ng ginagawa mo. Okay? So, yun. Dalawa. Remember, make sure you are safe. No, kasi there are some cases na nagkakaroon ng violence against medical health workers, and then don't let others validate you. Don't depend on the validation of other people.
Okay, thank you so much for that answer, Doc. And next up is, how do you help kids during this pandemic?
Okay. Of course, you have to teach them to at least understand in a way the whole situation. Never lie to children. Huwag niyong masyadong maging figurative ng pag-explain. Explain it to them in the simplest form that they would be able to understand. Okay? And it is also important to let them know what will be their part dito sa ating situation right now para hindi sila alienated na lahat tayo adults na may problema, sila hindi nila alam na malaki na pala yung problema ng mundo. Parang gano'n. So, help them identify ano kaya yung magiging role mo, no? If I remember it right, may nakikita ako ng mga videos ng mga bata, telling people to keep their distance, to wash their hands. So you can let them do that para ma-feel nila na meron akong parte dito sa pandemic na to, that I'm actually doing my part.
Right. Okay, and next up, Doc. Hi, Doc.
Hello.
I'm on my 6-month postpartum. I have experienced suicidal thoughts, and because of COVID-19, I am forced to stay home because of my young one. Doc, I really don't understand myself because there are times that I really feel so down and useless whenever I think that I couldn't provide for my baby because I couldn't go on duty. What can I do?
Okay. First, your situation might be a mixture of both physiological, no, hormonal, and psychological at the same time. Okay, so what you can do first is you have, for the physiological side, you can consult your obstetrician about it. Okay, now for the psychological side, again, you have to learn how to assess yourself. Okay, kailangan maibalik mo sa sarili mo yung kumpiyansa by reassessing yourself. Okay, I am at home, ito lang yung pwede kong gawin. These are the limitations of this condition na nangyayari sa akin. So with these limitations versus these are my capabilities, ano ngayon ang magiging pwede kong magawa, no? And find then your purpose. Kasi most of the time, we only focus on our ability to earn money. Hindi lang naman yun ang ability natin. Okay. Now, if you are having problems, for example, or worrying about financial matters, hindi lang naman isang bagay ang pwedeng mong pagkakitaan. Kung hindi ka pa pwedeng pumasok, you're still staying at home, there are a lot of things that you can do inside your home that can bring you revenue as well. No? So be more creative, be more innovative, and don't make yourself idle for a very long time. Kailangan ang mind natin active yan. Active and productive. So do that. Reassess yourself, tignan mo kung anong pwede mong gawin at pagkakitaan sa bahay, and of course, please consult your obstetrician about it.
All right, so I hope Doc was able to answer your question, ma'am. And next up, Doc says here, pharmacist ako, I know how that medicine works. How can I set aside that mindset na pharma ko at I know the effects of medicines para lang mainom ko yung gamot ko?
Okay. So, if you're a pharmacist, you're particular in pharmacology, diba? Yung comparing and weighing the cost effectiveness, the safety and effectivity of medications, no? Kasama yan sa pharma. Okay? You can use actually that principle in the situation that you were asking me. I-check mo, i-weigh mo yung effectivity, for example, the safety, the advantages versus the disadvantages of taking the medication. Now, of course, if the advantages outweighs the disadvantages, then you can go for it. Pero kung sa tingin mo mas malaki ang negative impact nun, and then you have to control and stop yourself.
Okay. And next up, Doc, bakit ganon? No matter how I try to change my routine, ganon may nagsasabi sa akin to breathe in and breathe out or relax lang, pero I still don't feel really alive, and it worries me a lot.
Okay. Maybe you still haven't found the perfect way to relax and calm yourself. Keep on looking for that way to calming yourself. And again, you can use the ability to be flexible. Baka you are looking at the wrong angle. Try to look at another angle. Then from there, dun ka gumawa ng bagong sistema para you can calm down, you can recollect yourself and function better.
All right. And Doc, next one here. Hello, Doc. How do I help someone suffering from PTSD and whose first move is to avoid problems instead of solving it? There's helplessness, yet an increased want to solve it magically through avoidance.
Okay. Kung ikaw yung, for example, ikaw yung mismong patient, recognition is usually the first step. No? You recognize yung tinatawag natin kanina na CBT or the cognitive behavior therapy, no, is identifying and recognizing your thoughts, your behaviors, and feelings. So, pwede mong gawin yon as a start, no? And then, again, reassessing yourself. Pag na-reassess mo na, ma-recall mo yung start doing and creating system for a normal function. Ngayon, kung hindi mo kayang gawin on your own, that's the time you have to seek for medical, for professional help. Okay? Ngayon, kung halimbawa, ang pinapertain mong tao is hindi ikaw, somebody else, and you want to help that person, okay, first thing to do is identify if you are really the best person to help him or her. No? Kung ikaw ba yung best fitted na magtulong sa kanya, baka hindi naman kayo ganun ka-close, or you haven't established a good communication with that person or good relation with that person, so baka hindi ikaw ang best person. Kung hindi ikaw ang best person, you find the best person to help him. Okay? Ngayon, if ikaw you think is the best person to help him, no? Una, walang pilitan. No? Kung hindi pa ready yung tao na mag-open sa iyo, na magpatulong sa iyo, wag mong pipilitin. You can actually ease through him, no? Dahan-dahan. Okay? Pangalawa, pag nagtanong siya ng mga tanong sa iyo, don't answers like straight advices. Okay? That's why I always encourage people to seek professional help kasi yun yung usual difference. Pag professional, they let the patient realize and process on their own. Gina-guide lang nila. Okay? So halimbawa, tinanong sa'yo na sa tingin mo ba tutuloy ko pa tong trabaho ko? Or uuwi na ba ako sa Pilipinas? Halimbawa, ganon. Huwag mo sabing oo, ituloy mo, or hindi, umuwi ka na lang nga. Mas maganda yon. Huwag ganon. No? So ibalik mo yung tanong sa kanya in a very pleasing and a very witty manner na siya mismo ang mag-iisip, ay, sa tingin ko mas maganda if I'll continue my work, or mas maganda if I'll go home. No? So let him think. At again, assess if the person is ready to help himself. No, wag niyo kasi pag pinilit nyo, there are some risks of violence, there are some risks of resistance. Baka kayo naman ang ma-frustrate pag nag-resist. Okay, so expect, at lalo na sa umpisa na may resistance. So dahan-dahan yan. You have to ease them through. Pag hindi na kaya ng powers nyo, seek professional help.
All right, so thank you so much for that question, Kanila. I hope Doc Berris was able to answer your question. And next up, Doc, good afternoon, Doc. I'm a home care physical therapist. I currently have patients who are being treated at their homes, and they might be afraid of me contracting the disease to them. How do I deal with them?
Okay. Of course, kailangan you practice the proper hygiene, yung sanitation, yung proper system not to be carriers of the disease, no? And pangalawa, let them know that the things that you do to to sanitize yourself and decontaminate yourself, isabihin mo sa kanila yon na ito po yung proseso ko na pagkagaling ko from this place to this place, ito yung prosesong ginagawa ko para to make sure that I don't carry the virus, that I am disinfected or I am decontaminated. No, be very strict and vigilant in using your PPEs, yung hygiene procedures, lahat yon. They have to see that and they have to know that as well. Para sila mas magiging kampante na okay, safe itong aking healthcare worker kasi she or he practiced this.
All right. So thank you so much for that question, Joril. And then next up, we have here, hello, Doc. If we experience or witness an extreme situation, excuse me, what's the best way to cope up to not feel overwhelmed and get carried away? Excuse me. Can you suggest a mental exercise, or what do we do to be able to control our emotion or to calm down in the middle of it?
Okay, one of the best and simplest way to be calm is do the breathing exercise. So what you do, you go to an area wherein isolated ka. Kung pwedeng mag-isa ka lang, better. Maybe you can go to the cubicle of a restroom or to your own room. And focus on one part of the body. So halimbawa, yung tiyan mo, hawakan mo. And then you breathe in slowly through your nose, slowly and deep. And breathe out slowly through your mouth. Pero ang concentration mo dun sa nararamdaman mo sa paghawak mo ng tiyan mo. And actually, any part of the body. But example is yung tiyan. no? You do that about 10 to 15 times. After that, may significant calming effect yun. Okay? But just make sure it is slow and deep. Huwag mong bibilisan. Kasi pag binilisan mo, you can have hyperventilation. So, kailangan slow and deep breathing. So, about 10 to 15 times. 10 times is actually okay. Pero kung talagang panic level ka na at that moment, you can do that 15 times. Ngayon, if you do not have the luxury of time to do that, okay, just stop for a few seconds. I-blanko mo muna yung utak mo, stop for a few seconds. Tapos, after a few seconds, tsaka ka lang mag-umpisang mag-isip. At ang una mong iisipin, hindi kung ano yung nararamdaman mo. Ano yung pwede mo nang gawin at that moment. Okay? Kasi pag alam mo kung anong gagawin mo, it also calms you down.
All right. So I hope Doc Berris was able to answer your concern. Next up, Doc. Hi, Doc. It is self-centered to think about our individual concern in a world full of suffering. Is it shallow to worry about your own state of mind during the pandemic?
No, it's not. Before you're able to help other people, before you become a hero, before you make a difference, no, for the world, no, kailangan maayos ka muna. You cannot give things that you don't have. You cannot love if you don't love yourself. You cannot share if you don't feel complete and you don't feel full. No? So kailangan buuin mo muna yung sarili mo. So it is not selfish to think about your welfare before thinking about others' welfare. So kahit saang gera yan, kailangan equip ka muna. Ngayon, pag kompleto ka na, equipped ka na, buo ka na, that's the time you go out of yourself and extend kung ano yung kaya mong i-extend.
All right. So thank you so much for that answer, Doc. Next up, if a person who committed suicide before, can that person do it again?
Yes. It is always possible. Once na nagkaroon na ng suicidal ideation, lalo na kung suicidal attempt, no, there is always a possibility na maulit yon. That's why it's very important that that person to seek and consult professional help. Kailangan mag-guide yon. Kasi yung depression, hindi lang naman yan plainly psychological. It is also clinical. So there are some cases that you do need medications and there are some cases na kaya ng therapy lang. So kailangan ma-assess yon and only professionals can do that.
Okay. And next up, how to handle negative emotions, lalo na pag malayo sa family?
Okay. So sabi ko nga kanina, believe in the power of positivity. Pag meron kang negative emotion, tingnan mo sa ibang side, hanapin mo kung anong maganda ng sitwasyon mo. No? So if you are far from your family, kung nami-miss mo sila, no, mahirap yung sitwasyon, pero pwede mong tignan na pwede ko pa rin silang makausap. Pwede ko pa rin silang makita, no? We have all the ways to do that. At the same time, no, in my other lectures, lagi kong sinasabi, dapat ang mundo natin is composed of little worlds, hindi isang malaking mundo. Okay? Kasi pag isa lang ang mundo mo, isang malaking mundo, pag nasira yan or may difficulty dyan, babagsak ka kasama nun. So, kailangan matuto kang i-compartmentalize yung mga mundo mo. Your world with your family, with your friends, with your work, with your society, with your spirituality. Yon. So, i-compartmentalize mo yon. Okay? Para yung isang mundo na pangit ang sitwasyon, the other worlds could actually pick you up. So kung may negative emotion ka sa isang mundo mo, paghugutan mo yung mga ibang mundo mo to pick you up. Okay? Parang ano lang yan, kung halimbawa, financially, your financial world is crumbling down, you have your friends, your family, para hatakin ka. Okay? If may problema ka sa pamilya, may problema ka sa trabaho, you can have your spirituality to bring you up. So ganun. No? Kailangan hahanap ka lagi kung ano yung pwedeng humugot sa'yo pataas.
All right. So yeah, I hope Doc Berris was able to answer your question. And yes, Doc, that's really a good answer to the concern. Okay, so next up, Doc. This one came from Jason Ray. He said, "Hi, Doc. Good day. I have workmates who are so lazy to work. The level of stress increases every time I am with them. So if time of relaxation, we are happy, but when work time, I am always stressed with them because they only want to relax. How can I deal with them? Uh, how can I deal with them, Doc? Because I'm losing my motivation to work because of them."
Okay. First things first, you have to rechannel where you get your motivation. Again, your motivation has come from you, not from them. If they want to be lazy, then let them be lazy. If you can correct them better, if you know how to correct them better. Pero what's important is how you perform your job yourself. If you're doing your job quite well or even extraordinarily well, be happy with that. Kung sila tamad, ikaw hindi, at least ikaw hindi. No? And be motivated on that. No? Pwede mo ngang isipin, oh, kayo tinatamad, ako hindi. No? So at least ako hindi ako mapapagalitan. No, yung mga ganong hugot. Kasi kung magpapahatak ka sa kanila, if you mind them too much, you will be giving yourself unnecessary stress. So wala na tayong room for additional unnecessary stress ngayon. Just focus on the things that would pick you up.
All right. So Jason, yeah, I hope Doc was able to give you additional motivation to work. Yes, to work and to strive more. All right. So next up, Doc, this one came from Josefino Malco. He said
Hi.
here, "Hello po, Doc. Could government require all sectors, private or public establishments, to conduct counseling sessions or seminars among business owners and their staff prior to restarting work?"
Okay, I cannot speak for the government because of course I don't know their system, their resources and all. No, but it could be ideal if that would happen. Uh, pero in reality, no, the best thing to do is to check kung ano yung available sa area nyo at this time. Wag muna tayo masyadong umasa to other institutions or the government, for example, because I think they're having a handful of things to do right now. Kung maisip nila, maraming salamat po. Pero kung hindi, tayo munang gumawa ng paraan para sa sarili natin. No? The good news is there are some institutions who are actually providing free virtual assistance, psychiatric assistance. So you can just check on the internet kung ano yung mga available na yon na institution who gives those assistance. No? Wag muna tayo masyadong umasa sa iba. By principle, I always believe that kailangan you are self-reliant. Kung kayang i-provide ng iba, madugtungan ng iba, that would be fine. But it is important for you to be self-reliant. So ikaw na muna maghanap.
Okay, so I hope Josefino, Doc was able to address your concern. Next up, hi Doc, good afternoon. With all of the toxicity that is happening in social media, family and friends clashing over varying opinions, what is the best way to deal with this? That's from Jershom Rivero.
Hello. Okay, the best thing to do, minimize your exposure to your social media. Okay, so sabi ko nga, we don't need unnecessary stress right now. So kung nasa-stress kayo, for example, with the social media because maraming contradicting opinions and all, don't indulge too much on that anymore. No? Mas maganda siguro you read articles na lang on how to keep yourself healthy, on ano na ba yung mga developments for battling against COVID, yung mga ganon. Pero para makipag-away ka pa, para bigyan mo ng oras yung pakikipag-away nyo sa social media for something that you cannot even also resolve. Okay, baka magkaroon lang ng lamat yung mga relasyon nyo sa inyong mga pamilya or friends. Better yet, minimize your exposure.
Okay, so I hope Jershom, Doc was able to address your concern about varying opinions and clash over family and friends. Now, next up, from an anonymous attendee, how long should psycho drugs be taken before it's reevaluated or tapered? So, for instance, alprazolam is prescribed PRN. How to know if the patient is developing dependence already?
Okay. Depending yan, that's depending on the patient, on the reaction of the patient. No, kailangan talaga yan merong one-on-one evaluation. That's why if you consult to professionals like, for example, psychiatrists, not psychiatrists are the only ones who can prescribe these medications. So kailangan meron kang regular follow-up, meron kang regular reassessment. Hindi yung ganyang medical condition, hindi pwedeng ikaw lang mag-assess sa sarili mo. You should have a regular follow-up with your psychiatrist. It is the psychiatrist who will decide if you need to continue or not your medication.
Okay, so I hope Doc Berris was able to address that concern for you, ma'am or sir. Now, lastly, Doc, we have a last question here. How do we move towards resiliency?
Okay. So first, you have to make yourself ready to be resilient. Ihanda natin yung sarili natin to start building our resilience. Okay? You have to be willing, you have to be determined, and you don't give up. No, yung mga suggestion ko kanina, the 8 things that I advise actually for you to at least do in this crisis, you start the step 1. Do the step 1 always. From there, start building the resilience na. Kasi without doing the step 1, which is basically recognition and being ready, no, to do and deciding to do to be resilient, ay hindi kayo makakausad talaga. So in any process, step 1 is always the critical step. So start doing the step 1 now.
Okay, so let me just go back here, Doc. So I guess, Doc, that's all the questions that we have for this afternoon. And again, I would like to thank all the nurses that attended the webinar. Thank you so much. You are our heroes, so always take care of yourself. All right. To all the nurses all over the world who attended the seminar, those nurses from Dubai, from Singapore, Saudi Arabia, UK, if we have one. Thank you so much for being a part of this webinar with Doc Berris. And Doc, before we say goodbye, I think we have another one here, another question for you. May
Okay.
pahabol po. Okay,
Sige po.
so yeah. Yeah, the question is, hello po, Doc. As an accountable partner to a depressed person, what do you suggest for me to help him survive his depression and help him find motivation and see the positive side of everything or positive side in everything?
Okay, the best thing to do is just let him feel that you're there for him. Okay, you might not be able to directly help him dun sa pinagdadaanan niya, but the best thing to do is paalam mo sa kanya na nandyan ka para sa kanya. That there is always somebody who's ready to listen, somebody who's willing to help to the best of your ability to help. No, not all the time we can solve other people's problem. Actually, most of the time we cannot solve other people's problem. So just being there, being a friend or a family member, being a shoulder to cry on is actually enough.
Okay, so I hope the Doc was able to answer your question. And I guess, Doc, that's the last question, really last question. So again, our nurses, our fellow nurses, those who are watching us live on Facebook, I hope you have learned from this wonderful session. And of course, we thank the whole team, Health Carousel, Doc Berris, and of course the nurses that joined us, our candidates who joined us. All right, thank you so much for the participation, and again, thank you for the EOs of Health Carousel for this opportunity. And to leave you with this, before we leave this webinar, okay, to give you some points on Doc Berris's discussion, okay? So how to sustain a sound mind in the midst of pandemic. Of course, you as our frontliners, our heroes, you should enjoy life, all right? So you should think the power of of positivity, all right? Think of new hobbies, new skills. Resilience, of course, learn how to, the older generation is more resilient, but if you're familiar with the marshmallow test, hardship exists. Just delay your satisfaction. Focus on the things that can be controlled. All right. Sabi nga ni Doc kanina, let go of the things that you cannot control. Okay. And of course, flexibility. All right. Self-actualization. Learn to calm yourself. Align proper mindset. Socialize. Of course, not physical distancing. Okay. Because again, physical distancing does not mean social distancing. Okay. Do not isolate yourself. All right. And lastly, keep the faith. to yourself, and of course, to God. All right. And of course, stop, look, and listen and live. That's what Doc Berris told us. So for this afternoon, thank you so much for attending our webinar. Again, my name is John Paul Bringas, and I was the moderator. Thank you so much, everybody, and happy
Thank you.
Friday. Enjoy your weekend.
Thank you so much.